Hi, it's Dr. Haussmann at AR Health, answering your questions about a variety of topics. We had a rather involved question asked, which I think was a great question. I'm just going to read it to you to make sure I have it correctly. And the question was, can taking SSRI during the 90-day window period before you get tested for HIV suppress HIV antibody production and give an incorrect test result? And then the question asker actually linked an article from the National Library of Medicine that was entitled Selective Serotonin Reuptake Inhibitors, Suppression of HIV Infectivity and Replication. So I did take a look at that article, and we're going to talk about it briefly, but let me just kind of take a couple steps back, because there's kind of a lot to unpack with this question. But if I understand the question asker correctly, they're wondering whether or not if they're taking an SSRI, which are medicines that are commonly prescribed for depression, anxiety, like Celexa and Prozac and Zoloft and Paxil, could that cause them to not test positive for HIV, even though they actually do have it? And so I think that's what the main question that they're asking. I couldn't find any evidence that was true. There aren't really medications that interfere with the testing result in that way, although there are some people who speculate that people who take high-dose vitamins like biotin may have an effect on testing, since a lot of tests for antibodies are involved with biotin. So that's not something I'm going to get into today, but in terms of the SSRIs, I didn't find anything to suggest that would cause you to have a false negative test. I mean, false negative tests are possible with like all kinds of tests, because in the cases of looking for infections, you're looking for antibodies, and it takes your body a little time to build antibodies. And so until those antibodies are around, you can test negative even though you may have the infection. So we can maybe do another talk sometime about all the ways you can do testing for HIV. I'm not going to get into all that right now, but within 90 days, you would find the vast majority of HIV infections. Sometimes within the first couple weeks, you might not be able to detect it. So that's one of the reasons why you'll hear that you should get tested maybe more than once, especially if you know you had an exposure or a strong possibility of an exposure. So in any event, that was kind of the answer to that question. Now, the article itself was talking about SSRIs. It was kind of interesting to me, probably not to most people, but it was asking the question about whether or not SSRIs can suppress the activity of HIV. And so this study actually looked at people who were already positive for HIV, not people who were getting tested for HIV, and it looked to see whether or not their body was better at fighting off HIV, and there was some suggestion that it was. And so we know that for a long time that people who have depression, it often affects their physical health, and we know that depression often can cause people to have a worse case of HIV. So it sort of stands to reason that if you were treating somebody's depression along with their HIV, that they might do better. And that's kind of what this article was getting at. They specifically looked at something called reverse transcriptase, which is an enzyme that's part of HIV. That enzyme is like really important for the machinery of how the virus infects you and how it kind of replicates itself. And so what they saw was that people taking SSRIs, specifically the one called citalopram, which goes by the brand name Celexa, that those people seem to have less activity in that virus enzyme, which would suggest that the virus wasn't able to infect people as well. And that was what they were showing in this small study. So it's kind of an interesting study, and it does sort of make you wonder if the question asker was saying, well, if you have less activity of the virus, could that mean that you don't have as much virus around, so you wouldn't make as many antibodies, and that would make your test be negative? But I'm not sure that's really what they were asking. So to sum up, basically, SSRIs, if you're taking them, you don't have to worry about it affecting your HIV test results. You should get tested if you feel like you've been exposed, and you should talk to your doctor about what the right interval timing is for all of that, but you shouldn't worry about it causing a false negative. So good question, kind of complicated. Hopefully I didn't lose too many of you. But if you have other questions, please submit. I do my best to try to answer them. Take care.